The physical health effects of this pandemic are unmistakable. As we listen to the daily uptick of illnesses and deaths, we probe our own bodies for symptoms. It is the rare person who does not know someone who has been affected by the virus. But as dire as the physical consequences may be, we are only just beginning to look at the mental and emotional fallout from this pandemic, from the fear of catching this disease or losing our livelihood, to the grief over those who have been lost, and the sorrow over all the ways our lives have changed, seemingly overnight. And now we wonder what will happen to our relationships, our families, our children, and the challenges we're all facing. They're far from over. Today, we're talking to some experts in the field of mental health and relationships to help us all deal with our emotions. Fox 11 News in Depth starts right now. Hello, everyone. I'm Hal Eisner. We can probably all agree that the last couple of months have been challenging in a lot of ways on our mental and emotional health. We've had to deal with some pretty heavy stuff, huge changes in our lives, loss of friends, co-workers, and loved ones, tension with family members, friends, and colleagues. It's probably fair to say it hasn't been easy for a lot of us, so let's go in depth with licensed marriage and family therapist Dr. Sherry Myers and Dr. Lynn Yanni, and clinical psychiatrist Dr. Manuel St. Martin. Let's start with Sherry, and let's dig down a little bit on this issue of grief, because this is a really sizable topic. It's not just loss of lives, it's also loss of expectations and so many other things. Dr. Myers.
I think the hardest thing in this period is the anticipatory grief we're feeling, because we don't know what's coming around the corner. And the more we anticipate, the worse, the scarier it is, and the more we grieve. We look at our family, we look at our children, we look at our livelihood, and we go, what am I going to do? It's the first time as a collective that we are having to face the unknown. And literally, there's very few leaders to guide us as to what's going to happen next. That creates a lot of grief in our bodies because we don't know what's happening or going to happen, and we don't have the same means to protect ourselves, our loved ones, like we used to.
Dr. Yanni, it's that in the larger perspective, I suppose, but many people had trips that they had planned, they had family events, they had weddings, they had all kinds of things that they were looking forward to that basically died. And so in a way, they're grieving over all of those sort of things too, right?
Exactly. And that sets up a level of cumulative loss that is actually also a pandemic, because it's not even whether or not something's happened, it's how many different elements in one's life are damaged, destroyed, modified in some way, and every change invites a person to feel some degree of loss. So when they can't manage the feelings in sequence and move through them before another wave of loss hits, it makes it very difficult to get to a place where you feel like you're stable and you're safe.
Dr. St. Martin, there's a sort of a concept that I've really been interested in over the years, and that's the concept of unintended consequences. Boy, there are a bunch with this, aren't there?
Yes, one of the biggest unintended consequences is what happens after, because as we've seen in other pandemics and epidemics, the last pandemic that most people are aware of is the 1918 pandemic. But even with the MERS pandemic in the Middle East, that was in 2017, I believe, and the SARS in Canada and China, we saw that after those epidemics ended, we still had increased incidences of grief and anxiety and depressive symptoms in individuals who had been in contact with people. And surprisingly, one of the groups that had the highest incidence of anxiety and depression and grief type reactions was the healthcare workers.
Well, Sherry, there might be people watching us right now nodding their head, going, yeah, that's me. I'm feeling all of that. And so what do we tell them? I mean, there are all kinds of ways to cope. I mean, we can do breathing exercises. We can take a bite of our lip and go, and what can we do?
For me, it's gratitude, because whenever I get caught up in grief or sadness or fear, when I can get present and just say thank you Thank you for how beautiful it is today. Thank you that I am healthy. Thank you for this breath that I can take. Thank you that my children are okay. Thank you that I got my groceries delivered and I got groceries. It's a different world for us right now, and we are learning how to adapt and adjust, but to become present, take a deep breath, and say thank you for what is right now can help get us through it. Because the minute we go into anticipation, yes.
Well, I was just going to say a follow-up to that really is that a lot of us are sitting here and we're feeling this incredible loss, but we had to, as humans, suddenly adjust to this. I mean, one day we were one thing, one day we were the next thing, and the next thing you knew, we had to change. We had to become different people. We had to get technology to help us through things which we didn't have umpteen years ago. I mean, this is something people will write books about in the decades to come as they look back at what happened here. But I think that there's another subject here that's very, very important. It's grief, and then its cousin, fear. And that's what we're going to talk about when we come back on Fox 11 News in Depth. When we return, we will look at the pressure of fear and the impact it has on our mental health. We'll be right back. Welcome back to Fox 11 News in Depth. I'm Hal Eisner. We're talking with Drs. Manuel St. Martin, Lynn Jani, and Sherry Myers. And, you know, we have some disturbing recent statistics showing how the coronavirus crisis is impacting mental health. Let's take a look here. A Kaiser Family Foundation poll shows that nearly half of Americans say the pandemic is hurting their mental health. And a federal emergency hotline for people in emotional distress registered more than 1,000% increase in April, 1,000% increase compared to the same time last year. And our governor has repeatedly reminded Californians help is out there if they need it.
If you are feeling lonely, if you are feeling sad, if you're feeling depressed and anxious, if you are fearful, if you know somebody that is, please check out our covid19.ca.gov website.
So help is really easily accessible. Tell me, Dr. St. Martin, what are you seeing in your practice?
In my practice, I have a lot of patients who have anxiety disorders, and they're at a heightened level of fear anyway. So I see that they are more concerned that they are isolated, that they cannot communicate with people, they cannot do their normal anxiety reducing activities. That may be going to the gym, it may be taking a jog, it may be visiting with a family member or friend, or it may be going to a support group. Those things are harder to do these days because we're so isolated. And isolation is one of the things that is going to increase the person's level of fear. There's also a lot of problems for them to get in touch with mental health practitioners. If they do not have a established mental health practitioner, now is a very hard time to establish that because you're cut off from the normal means, which is going to an office, making a telephone call. If you don't have televideo or telemedicine opportunities, it can be very hard to find somebody who you can make an alliance with to help reduce your fears.
Well, Manuel, let me ask you this. I mean, we have all kinds of fears. We have fears of getting COVID-19. We have fears of the unknown. In some cases, we have fears of government, right?
Well, we have a fear of government because we don't always get proper information. One of the things that has happened in this day, as opposed to prior epidemics or pandemics, is that there are numerous sources of information. Not all of those sources are equally good, and individuals, depending on what is available to them, will gravitate to certain sources. That source may not be giving them correct information. When you get poor information And even worse, when you get no information, that's going to increase your fear. So it's behooves the government to basically make sure that they can get a message out, a consistent message out that everyone can access. The next thing about fear is that we are dealing with a virus, and a virus is something that you cannot see. Whenever a fear involves something that is invisible, it tends to heighten the person's anxiety because they don't know how to avoid it. We have put into place certain restrictions, quarantine, we wear masks, but it doesn't mean that the person is going to be composed because we have these restrictions and these methods in place. They can still be fearful that they are going to get it. One of the conditions that we see in psychiatry a lot is obsessive compulsive disorder. And one of the manifestations is those persons are typically afraid of germs. Now, there are a lot of people who don't have obsessive compulsive disorder or maybe had a subclinical disorder. And now, because of the SARS epidemic, it has kicked it into a full-blown disorder. So we see that too. The next
Well, let me ask you this. Let me ask this because there's another angle here too. Let's ask Dr. Yanni. Was one of the early manifestations of fear, and I'm not a doctor, I don't know. Was one of the early manifestations of fear the rush on guns and making sure that people felt a sense of protection? Is that part of that?
Yes, because fear, if it's kind of untreated, manifests in different ways that are more externalized, like reacting with anger. We were afraid to run out of toilet paper. We are afraid every day. And again, that's a cumulative effect. And the other piece I think that's really important to recognize, which we're all experiencing together, is that there isn't anybody who's not going through this. So it's hard to find that level of help in somebody who's feeling stable and clear-headed when everybody else around you is really manifesting, a need to protect themselves in various ways, like the guns that you were talking about. I also hear that on those levels of, there's a polarized system going on where people are either in overcrowded kind of conditions or they're isolated. And again, just your own internal barometer, it's so different than the way it was before. There's a loss in that change, and there's no one necessarily to reach to, although thank goodness they have authorized now most teletherapy and telehealth in general is now being covered by insurance, when that wasn't the case a couple of months ago. I knew that they were thinking about it, but now they've allowed that to happen in a way that's, authorized, so that it does give more people access to more providers in different regions because they're not able to seek physical like they would have.
It's really interesting because when you take grief and you take fear, it really has a very compounding effect on people. And maybe we can pick up on that and also talk about relationships and begin with Dr. Abrams, Dr. Myers, when we continue on Fox 11 News in Depth. We'll be back right after this break. We're back with our guests, Drs. Lynn Yanni, Manuel St. Martin, Sherry Myers. Thanks for being with us today, all three of you. Our enforced stay-at-home orders have left us cooped up together for, in some cases, as much as 2 months, with kids distance learning and parents working from home. All that togetherness has not always made people feel close to each other. In fact, we've seen a spike in domestic violence cases, or what's also known as intimate partner violence, as it's officially called. New estimates from the United Nations Population Fund suggest that 3 months of quarantine will result in a 20% rise in intimate partner violence, a 20% rise throughout the world. In total, the report predicts at least 15 million additional cases of that will occur as a result of COVID-19 lockdowns. Dr. Myers, what do you think could be the cause of that?
I really think it's the built-up stress that is accumulating based on what we talked about, grief, fear, and we're cooped up. So we used to be able to go out and separate and then come back and hopefully see the better of each other. Now we're sitting together and even not so together, feeling stressed out with no really good ways to vent them. And so, unfortunately, it's heightening anger, it's heightening tension, and it's really important to consciously make choices to do the opposite, to smooth things out, to sit and talk to each other, to find at least 5 really good things about each other and tell each other that every day, and to show love in small ways, big ways. Because unfortunately, one of the things that COVID has done is it's made us afraid to kiss, to touch, and connect in ways we used to. Like, it was really natural when I saw my adult kids to hug them. I don't do that anymore because I don't know. They want to protect me. And so we're having to relearn ways to communicate love that is different. But for
and it's
every
not just
couple,
it's not just yeah, but it's not just the relationships at home. It's the relationships at work. It's the relationships of people that we have been friends with, and all of a sudden, we're kind of doing this, aren't we? We're finding a lot of tension that's exposing itself. And so, be that the case, and we see this increase in partner violence. And I got to tell you, even when I go to the grocery store, and in my county, it's not required that you have masks, but most people wear them. When you get into the store and you see 1 or 2 people not wearing them, I run the other way. I mean, we are all physically, emotionally reacting to things that trigger us. And so I'm wondering if we could take a second here with all 3 of you and start with Sherry. How can we cope? Let's give everybody a little tip on how we can cope, how we can get through this a little bit better.
Taking care of yourself, mind and body and heart is the most important thing, because there's lots of things to react to. If you're heightened in stress, you're going to react a lot more strongly. So most importantly, it's really important to do 3 acts of self-love every day. Take your top 3: exercise, singing in the shower, telling your kids, your husband, your partner you love them, looking in the mirror, saying, I love you. But 3 every day, just to calm.
I'll stick to singing in the shower, because otherwise I'll probably stress out people even more. But Lynn, why don't you pick up on that? What's another tip you'd like to offer?
Okay, in addition to the self-compassion, I think it's really important to recognize that we have gained some things in this experience that we wouldn't have likely gained ever without it. Like, there are certain families that have spent more time together than they ever would have in the future. People whose kids returned home from college. You're actually in a situation with a spouse or a partner or a family member that gives you an opportunity to be more intimate. So yes, it's complicated and difficult and it's brand new. We have some learning there, but if we allow ourselves to go, where's my opportunity for growth here? Then what happens to you is also something that's happening for you, and you can have a degree of gratitude and a degree of compassion toward others that makes all the difference in the world. Because when you have compassion,
let's take that a step. Yeah, but let's take that a step further, because I want to ask Manuel. Time is short. I want to ask Manuel real quickly, Dr. St. Martin. The question is, for people who actually have mental health issues, what do we do? And we got about a minute for this. What do you tell them?
Well, the ones who have the mental health issues, there are still ways to get help. There are still hotlines to call. If you're feeling depressed, if you're feeling suicidal, you should make use of those. You can still reach out to people who are close to you, even though it's not going to be a physical closeness. You want to be connected to people, even though you can't have that physically. That's going to reduce mental health problems. Isolation, physical and social isolation, are the worst, and social isolation is probably a worse predictor of poor mental health than the physical isolation. So anything.
Well, there's clearly an awful lot for us to have to think about here. And Dr. St. Martin, Dr. Myers, Dr. Yanni, I want to thank you all so very much for taking some time talking us through this. We could talk for hours, couldn't we? But we can't. We're out of time. So thank you so much. When we come back, we'll have more on Fox 11 News In Depth. If you haven't already, I hope you'll check out my podcast, What the Hal. It's available wherever you get podcasts and at whatthehowpodcast.com. Well, we've talked about a lot of heavy stuff in the last half hour, from fear and anger to grief and loneliness. But the things that will get us through all of this are two other emotions the doctors alluded to, and that's love and compassion. We've seen a lot of that throughout this crisis. In fact, a local producer named Kristen Marion with Big Bite Productions is about to remind us of a number of local examples. Hang in there, everyone. We'll get through this. See you next time.